Hi, this is Brian Kim. I'm going to share with you this technique of orbital fat prolapse excision, which I learned and adopted from doing lower lid blepharoplasty and removing the orbital fat. You may have patients that you've seen with this large amount of orbital fat in the superior temporal quadrant of their eyes. I want you to know that this is a very easy, safe, and straightforward procedure, and it doesn't even require sutures. So you first need to place a traction suture in the superiotemporal episcleral tissue. I believe this is a 4-0 silk traction suture. And then you rotate the eye infranasally, and I'm injecting some 2% lidocaine with epinephrine in the subconjunctival space, and then I'm just massaging it bluntly with the cotton tip. And then incising the conjunctiva at the level of the fornix, again superiortemporally. Once I incise the conjunctiva, I'm going to incise into the Tenon's capsule. Once you get through Tenon's capsule, you can see the fat begins to prolapse. You see that very clear yellow tissue, and it starts to come forward. And it's fairly avascular. So you want to grab it and just gently, bluntly kind of pull it upward. I'm using the scissors to help me do that. And then I'm using a hemostat to get fairly deep and flat, making sure I'm not catching the skin or the conjunctiva or tenons. And then I'm clamping. And then you start to excise that fat. And because of the clamp, it helps with hemostasis. It also helps with a very controlled dissection and resection of the fat. And then you want to cauterize the stump. By cauterizing the stump, you just help ensure there's good hemostasis when you remove the hemostat. And then you release the hemostat, and the tissue retracts back in. Want to make sure there's no bleeders. And you just reposit the conjunctiva, and this doesn't require any suturing. I'm going to go ahead and remove the traction suture and go to the other eye. Again, this is superiotemporal. I'm sitting supertemporally, and so this is the right eye. I'm doing this under MAC with some topical anesthesia, so you can see that the patient's reacting a little bit. I'm turning the eye infranasally again, and I'm going to inject 2% lidocaine with epinephrine underneath the conjunctiva and the supertemporal quadrant of the conjunctiva where the orbital fat is located. And then after massaging it and giving it a little bit of time, go ahead and incise into the conjunctiva again at the level of the fornix, and then incising through the tenons. Once you get through the tenons, you can see that the fat starts to come forward. I'm switching to some conj forceps here. Once I'm able to bluntly isolate the fat and lift it upward, and use the hemostat to clamp again at the base of the fat, making sure I don't grab the skin or conjunctiva or tenons. The crushing force on the fat also helps with hemostasis. It's a very controlled way of being able to excise the right amount of fat you want to remove. You cauterize the stump. And then release the hemostat, and the tissues retract back in. Just want to make sure there's no bleeding. And that's it. There's no need for suturing. The deep tissues retract and the conjunctiva is easily reapproximated. And you remove the traction suture, and that's the end of the case. So again, I'm using techniques that I learned from lower lid blepharoplasty, sharp and blunt dissection, pulling up the fat, isolating it with the hemostat, cutting it, and then cauterizing it. So I hope this was helpful to you, and I thank you for your attention.